In this video, we're going to cover the Community Transition Assessment, otherwise known as the CTA. We'll talk about its contents and how to save a copy of the CTA. So the CTA is really just the full assessment that transition navigators perform to help successfully transition participants into the community and get to know their needs. The living CTA is located within a NIFTY record, and it's automatically added when a NIFTY record's added. So to add a CTA, you just need to add a NIFTY record. So I'm on the NIFTY record. Or the NF transition node, I'm going to click the add button. And then I'm going to be prompted to enter the initial interview date. The initial interview date should just be the date that the initial CTA occurs. So you're going to enter that here. If you don't know it exactly, you can update it after you add this. So I'm going to go with 8/16/2020. And you can also use this calendar control guide and click something. Whoops, that's the future. Something on that as well if you don't want to type it. Then I'm going to click add. Now that I've added a NIFTY record, you can see that I've also automatically added a living CTA. So we call this the living CTA because it's basically a living piece of documentation that will continuously be updated as time goes on. You can save copies of the living CTA, which is basically a snapshot of the assessment at a given point in time. The specifics of that process we'll cover later on in this video, but basically you need to know that you enter all your data into the living CTA, and as time goes on and there's updates with the participant or their health changes or whatever it may be, when you document those changes, you're going to do that in the living CTA, and you'll just find whatever fields are applicable and update those, and then you can save a copy of the living CTA to preserve a copy of that data at that exact point in time. And next, I think I'll just go through all the major sections of the CTA and do a brief explanation of what each section is, and then I'll go over any notable fields within that section that might require a little bit more of an explanation. So just to start, there are 10 major nodes within the CTA, and the barriers are really just one. Barriers and barriers continue. The only reason it is broken up like that is because we had a database limitation where we couldn't have that many fields all under one node. So we had to break up these subnodes into two kind of sections, barriers and barriers continued. But don't think that there's any other reason that they are split up. It's just because we couldn't fit everything into one. So let's start with the first node, general. General is pretty short. There's only a few top level questions in here, starting with the CTA date, the date of the in-person, face-to-face meeting. So this is just the date that you did the CTA. And if it takes a couple days, just use the first date that it started. And you might be thinking, why are there two fields, the initial interview date and this, that are going to be the same? Well, this is because, down the line, it's possible you need to reassess the participant. Maybe they have major health changes, or it's been a year and their eligibility is going to expire and you're still providing services, or maybe they haven't quite transitioned yet and now you need to reassess. Well, when that happens, you're going to go back into this general node and then update this CTA date to the new date. So if it's a year from now, maybe it's just 8/16/2021, then you're going to do that here so that when you save a copy of the CTA, you have the new updated date that this, reassessment occurred versus the initial interview date, which is the first CTA that ever happened, which marks the beginning of this attempt. So this one will never really change after you've entered it and you're, satisfied with it. You can obviously change it if you need to in the beginning, but down the line, the only thing that will change is this CTA date. So that's how that works. It's going to be required and should always be present. You can't null out that field. So the next important date is the date of referral. So the date of referral is tied to the referral node. There's a separate training video on referrals if you have any questions about adding referrals, but you need a transition services referral for all CTAs, and because that kind of starts this transition process. So if I look under my referral node, you can see I added one at 8/10/2020, and it's this transition services type. So since it's that transition services type, it will show up in my CTA data referral dropdown. So now I can see that and select that as my referral. If you're using the referral node for other reasons, there's so many different referral types, that's fine. And don't worry, those will not show up in this dropdown. This is keyed so that it'll only show up or only show transition services referral types. So once you've selected that, you're good to go. It is required to save a copy of the CTA and to submit a notice. So you're going to want to fill that in as soon as you know it. Next thing is the Transition Navigator dropdown. So the Transition Navigator field is where you should track the current TN, and it's a dropdown that's populated with all the active transition navigators from your agency, and that's just determined by people who have the Add Change NF Transition Agent permission. So if you're not seeing yourself in that or someone else that you're looking for, then go ahead and go to Manage Users and check out their permissions and make sure that they have the Add Change NF Transition Agent permission. Otherwise, they won't show up in here. Another limitation is that you'll have to be active. So if a transition navigator leaves the organization because, they're just done working with them or for whatever reason, you don't want them to show up in this list anymore. So we use the account enabled checkbox in the user account to decide whether to show a person. So I have another tab open to show you what that is. This is that checkbox in the user profile under details. If this is not checked, they will come out of this list so that you don't continue to see them as an option after they've left the agency. So how you do this too is you look up the person that's going to leave and you literally uncheck it. But there are a couple rules about this. Is you cannot uncheck someone that's currently selected in a living CTA. So if I have Mary Demo selected as my transition navigator, if she ends up leaving down the line, you're going to need to remove her from any living CTAs of open records. If the record's closed, it's fine, you can leave it in there. The system's not going to be mad. But anytime you have a transition navigator in an open living CTA, you're going to need to remove them. And you can find all those cases by using the Nifty selector and filters to figure out how many places Mary Demo is used in an open CTA. And so once she's removed from everywhere, you'll be able to successfully uncheck this box, and then she will no longer show up in this dropdown. So that's how that works. And then anytime there are changes to this list, which means that there's changes to user accounts, whether it's someone being added to the list or removed, you're going to need to log in and out to see those changes actually in effect. So the Transition Navigator is also going to be required to submit a notice because, we need to know who that is. The rest of these fields are just contact information for the TN, and these are also required to submit a notice, so you'll want to put those in. Phone extension isn't because that's obviously optional, but phone and email are. So that's the general node. Everything's important in general. The next node is your nursing facility move. You can see the rest of this by moving that over. So the Your Nursing Facility Move section is really just includes information about where the participant is transitioning from, and what their life was like before they were admitted to the nursing facility and what they want their life like to be after they've left the nursing facility. So there's a lot of different questions. They're pretty straightforward. There's just a couple things to point out in this node. This section of where you enter the nursing facility, you'll notice these are all read-only except for the date of admission. That's because you need to use this lookup tool to actually fill out the nursing facility name, address, and all that good stuff. So to use this, you just click on the lookup button, and then you have two different search fields. You can search on their name or search on the city where the nursing facility is. So I'm going to just go ahead and type in the beginning of Frankenmuth because I know that there's the Mare Lodge of Frankenmuth. So then just to select this, all you have to do is click this blue check mark, and it'll automatically fill in the nursing facility's address and all those details. So if you need to change it, you can just click the lookup button again and then type something else, and reselecting another place will just override the existing one like that. Or if you want to clear out these fields for some reason and you don't know what it is, and you don't want the wrong thing to be sitting there, you can just use this clear button to clear it. So that's how that works. Something else to keep in mind is if you're not seeing what you're looking for in the nursing facility tool because maybe there's a new nursing facility, or you see an error because an address or name has changed, please email CIM's help desk at cimhelpdesk@ciminc.com and just let us know the name and address so that we can correct that or add it, because we do maintain that list. One other thing to mention in this section is the primary diagnosis field. So primary diagnosis / this ICD code field was added because of a requirement for NIFTY claims. So when CHAMP starts accepting them, that'll be great to have this in here. So the primary diagnosis field is the typable field, and then the ICD code is this read-only field that will populate with the ICD code once you've selected a disease from the list. So you can just start typing whatever your disease is, or you can type in the code, like for example, and I can select any of these, and then it'll populate my code in there. And then this clear button is because when you try to clear out a disease or here and you think you're done, well, the code still stays. This was just a limitation of the system that we could not get to work. So in order to clear out that so that that doesn't print on a report when you don't have a primary diagnosis entered, you just use this clear button and that'll wipe that out as well. So just keep that in mind if you need to null out the disease. All right, so the next section is support system. So support system is just a place to record the participant support system. There's a place to enter decision makers, if there are any. If there are none, you can use this set all to no button, which will set all these fields to no. Then there's some follow-up questions about decision makers if there are any. And then there's a place to enter informal supports if the participant has any, and people that the participant might want to exclude from transition planning. So that's the support system section. If you have multiple supports, just enter them all into this memo. You can just, do something like this, blah, 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 and then the next person, etc. So if there are multiple supports, just enter them all into this memo box. I know there used to be in the form a place to enter each of them separately. We figured this was a little bit more efficient. All right, so the next section is functional abilities. So the functional abilities section includes all the ADL and IADL measurements. It looks like a lot. It's just because for each measurement, there is a self-report, transition navigator report, and nursing facility staff report options. The important one is the TN report one, because you're the person that's assessing them, and hopefully has a good idea of what's going on. So those are going to be the ones that are required. Self-report and nursing facility staff report are just optional and great to have if you know it, and you should definitely put them in if you do know, but if not, you can just answer the TN report ones. So for each of these measurements, there is unknown, independent, setup or supervision, hands-on assistant, and fully dependent as the options. And those are going to be the same for each of these different measurements. So if the participant is mostly independent and they just have a few issues, then maybe you want to use the set all to independent button. That's going to set them all to independent, and then you can change, whatever ones that they might struggle with and kind of save times that way. There's also a separate button for the IADLs, just to keep that kind of separate if they're better at one group than the other. So that is the functional ability section. Next is financial information. So the financial information section includes all the financially related questions. So all information related to insurance, income, assets, and outstanding debts should be recorded here. The first thing to kind of point out is there are a few read-only fields you'll notice. This Medicaid ID, the Medicare, and Part A, Part B, Part C, Part D, effective fields, and I think there's some veteran fields, yeah. So all those are read-only, and you can't actually edit them in the CTA because these fields are actually just displayed here from the participant record. So these were fields that already existed in our participant record, but were also requested to be a part of the CTA. And so since we already had them in the participant record and we're not taking them out of that because they exist there for other programs, we designed the system to just display the data from the participant record in the CTA just to kind of minimize duplicate entry. So if you need to answer any of these fields, you're going to need to go to the participant's name, which is the participant record, and find those fields here. So if you scroll down, you can start, seeing some of them. Let's just fill in some for an example. Okay. And these fields will always be editable. They don't lock down. So now if I go back to financial information and I go to the Part C, I'll be able to see this data that I entered. So that's how those guys work, which is just a little bit different, but we wanted to minimize the duplicate entry. So that's how those guys are going to work. The next thing to pay attention to is the income calculation fields. So if you're a waiver agent, you might be familiar with these income fields. It's very similar to what we have in our waiver assessment. So basically you have all these different sources of income for the person and the spouse, and you can fill in whatever it may be, and at the bottom it'll calculate a total for you guys. So you can kind of see how that's changing. And then this will come up with a gross household income, which is a combination of person and spouse. So you can see there's the total. The assets work the same way. There's another, nice big long list of potential assets you might have. And so there's calculation totals for those guys as well. Those calculated totals will not be editable themselves, but you can update them by simply, entering the appropriate info into the fields that make up the total. Okay, so next section, there's not a lot of other, interesting things in this. So I'm going to go to the barriers. So the barriers are broken into two sections, like I said, just because of that database limitation of not being able to fit all the different fields into one subnode. So that's why we have the barriers and barriers continued. And the barriers are sectioned into subsections themselves. These are just different types of categories of barriers that the participant may face when they're transitioning home. These are important because the barriers tell us the transition, or tell us, what barriers there are to transitioning into the community and what types of services the participant's going to need in order to successfully stay in the community. So the typical structure to these sections is to ask a question about a potential barrier and then ask any other related questions that will provide more information, and then ask the participant if they require assistance, and if they do require assistance, then what's your plan? How are you going to assist them? And so a good example of this is in the identification barriers section. So like, do you have identification? Okay, you do, so where is it? And if you don't, what's your plan? So you're kind of, in a nice narrative way, creating a plan for the participant for any barriers that they end up having and needing assistance. And then all these plan fields end up being included in the transition plan, which is shared with the participant. So you guys are making a transition plan together. So you can see this is pretty much, I'm trying to pick another one where it's the same type of setup where, do you have shortness of breath? If yes, what gives you this? And all right, so how do we treat this? And do you have oxygen? If you do, can you manage it in the community? And what's your plan? And, it just kind of keeps that repeated structure of, do you have this barrier? What are your limitations? And do you need assistance? And what's your plan for having that assistance? So those are the different barriers. I'm not going to go through each of them because I'm sure you're kind of familiar with that from the paper form already, and they're pretty straightforward questions. Although there is one section that I'd like to point out is the housing section. In the housing section, it's broken up into 3 sections in itself. The I have a home to return to. You would answer these questions if the participant has a home to return to, so that's kind of how they're narrated. And then there's the I do not have a home to return to. So if you don't have a home to return to, you would skip these guys and just answer the I do not have a home to return to. And then lastly, there's the housing barriers. So this is for people that do have a house, and if they do have a house, these are the barriers to, still having that house. Like, oh, I don't have furniture, but I still, so I need a plan for that. But they kind of apply to if you don't have a house too, because you would still need furniture. So they're kind of like these in-betweener questions that we didn't know which section to put them in. So one more thing about this section is if you don't have a home to return to, you're still going to need to click the Set All to No button under the Does your home need any of the following services before you can return? So unfortunately, these questions are required to submit a notice if you do have a home to return to. And since we don't know that or not, they're still going to be required for people that don't have a home. So if you don't have a home, just make sure that you click this, and that'll set all these different house modification, repairs, deep cleaning, things that are specific to home people to know, so that you at least can save some time that way. So that is the housing section. Something else that's interesting about the barriers and just the CTA in general is there are these, in context referral questions that are sprinkled in. So referrals are basically times where there are barriers that require help from someone that's outside the agency. So maybe it's specialized assistance or just something that you want to refer out and not do in-house. So for that reason, we have these different places in the CTA where you can record referrals in the assessment with the related questions. So an example of that is in, maybe let's do harmful behaviors. So there's these different questions about harmful behaviors, and then if there are any harmful behaviors, what's your plan, and if you don't have a plan, would you like assistance with it? And if you need a referral, that's, you could refer that out here. Or if they had mental health issues and they need a referral from a mental health counselor, you can put that kind of information here. So you'll see these types of where it's referral, date given, contact person, contact info, those 4 questions grouped together in different places in the assessment that typically need a referral. And something else to note is that all these referrals are included in the transition plan so that it's clear to the participant, who their referrals are, and to the transition navigator, who they need to work with and follow up on. If there is any follow-up work associated with a referral, like finding someone or just making a note to remember to call them and get that set up, then you can just add a user added to do to remind yourself by opening up the to-do list and just clicking add and maybe making a note like, so that's how you could take care of that. Okay. So the next section is HCBS eligibility. Close this. The HCBS eligibility is just a place to mark. There's this area that you can mark all the different services that you think the participant might be eligible for. That's what this first question is with all these check boxes. This will also be included in the transition plan. And then below that is the HCBS eligibility outcomes. The outcomes are read-only calculation fields that either could not be calculated, not met, or met. So these are basically read-only and filled in as soon as enough information is entered to calculate it. This is basically your eligibility. There used to be a paper form and you guys would do this manually, but now we have this all electronic. So based on your answers in the CTA, that have the different eligibility questions sprinkled throughout, these will calculate, and this is where you can go to see, how you've done and how your participant basically fares with eligibility. So the outcomes are broken down by their criteria and sub-criteria so that you can easily see, where they're struggling and what barriers they have. Something else to note is that this field, if HCBS eligibility is not met, but the transition navigator feels participant should be eligible, please explain. This is an important field that you would want to enter before you submit a notice, because if for some reason you've gone through the CTA or you've gone through the eligibility questions and they aren't eligible, but you think that they still should be, you can explain that here. And then the state will see that and, make a decision based off of that. And then lastly, there's also a place to enter any other agent comments about the notice ineligibility that you would want the state to pay attention to, or just miscellaneous information you might want to record. So that is HCBS eligibility. There's the additional referrals. So this is a place to add any additional referrals that weren't in context in the CTA. So if they weren't covered in the assessment, but you still need to do a referral, then you would do that here. The way you do that is click Edit and click Add, and then you need to fill out who the referral is made to and the reason. So I don't know, maybe IHA field, maybe it's for PCP. And now I can click Add. And it's a standard multi-record data grid where you can continue to add more referrals. You can fill out this other information when you know it, the date given, the contact person, their contact information. And then this last thing, HCBS program. This is, so if it was a program referral, you would check that. If not, no. So if I add another, Region 2. say it was a waiver program referral, and add it. Then I'd want to make sure that I go to this guy and then just check this box, and now it'll be yes. And so that way when I save it, it'll on the transition plan, it'll break these out into program referrals and then just additional referrals. And so if I go back to the case file too, we save them in 2 different summaries for you guys just to kind of be able to read that easier. So that is additional referrals. Next thing is transition task list. So the transition task list again is a data grid entry method. So to add a task, you just go into the edit mode and click add. The tasks, this is just a place for users to track their transition tasks. This could be something like order medications, order DME, whatever it is, but you'll just enter that task here and then click add, and then you can assign the task to someone that maybe it's maybe it's me. And then there's this task completed by, you can say whoever that is, and then task completed date time. The important part for this is that you need to use the calendar control just because it's easier with the date and time. Otherwise, if you type in here, it's just a little bit trickier of formatting, which you can still do. Let's say I completed it around noon. Then it'll just do that, and it gets mad at me. See, I don't have the AM PM. And that's how you add tasks. Something to note that I want to add another one that's not completed, because we do break up the summaries into completed and not completed just so that you can kind of see which ones you still need to do easier. So I'll do, and then save and return to case file. Now you can see the not completed at the top and the completed down here, and as time goes on, obviously the completed list will grow. So that is tasks. That I think is all I got for that. And then lastly is transition services list. Again, it's a multi-record editor so that you can add multiple services. To do this, click add. This is the place where you record any transition services that will that you're going to give to the participant. This will also appear on the transition plan report. Services recorded here are not going to feed into MySys or any other CIM system for a validation process, but you should be adding them here because the state's going to be looking for them. So the way this works is you need to enter the HCPCS code. This is a drop down. You can select whatever service you're trying to add, and then if there is a standard remark, you can add it here. If there isn't, it's not going to be an option. And then the name is a read-only field that will populate based on what you've selected here. And then the description should be entered when there's something else different about the service that's like a small deviation that you might want to record. Waiver agents will still need to add their services in MySys just like normal in order to bill for them. So the services added here too are not going to be going under some formal approval process within our system like the notice and eligibility and exceptions do, but the state did request that you add them here so that they can show up on the transition plan and just assist them during the review process for billing. CIM has loaded just this full list of HCPCS codes that are related to and their related standard remarks. But one thing that you won't see in here is the T1017, which is the transition navigation services. This is because the state said that we can always include that on the transition plan report instead of having you guys enter it for every single participant, because every participant would have that. So even though you won't see that here, when you run the transition plan report, you will see that automatically print on that. So that is transition services. Oh, that is a lot. But one last thing to go over is saving a copy of the CTA. So the living CTA will change over time like we talked about, and there'll be many times that you might want to save it, and there's no limit to doing this, although you might want to do it sparingly because you're just going to end up with a long list of saved dated CTAs under here. So the way you do this is whenever you're satisfied with what you've entered and you want to take a snapshot of the assessment at that point in time so that it's saved, you will just click this Save Copy of CTA button, and it's simple as that. So by clicking this, I'll have a confirmation just in case you accidentally clicked it and don't mean to. Cancel won't save a copy, and OK will. So once I click OK, now you'll see there is the date of today and the time that I clicked the button, and then you can see this little lock icon denoting that this is a copy of the CTA and everything is locked and saved. So now if I go through here, I can see the different stuff that I entered, and there's no requirement to how much data needs to be filled out besides the fact that you need to have the date of referral and the transition navigator. Other than that, there's no requirements. So the rest of the CTA could technically be empty, although you probably don't really want to be saving a copy if the rest of the CTA is empty. The button will be available anywhere on the living CTA. Whoops, did I click here? So you should be able to do that anywhere from the living CTA. And I just want to also mention that you do not need to be doing this anytime you make changes just to save your data. Your data is not going to go anywhere as soon as you enter it in the living CTA. So just don't confuse that process. And if you make a mistake and you save a copy and you didn't mean to, and you don't want that saved in the record, you will not be able to delete this just because it's, a locked version. So you can just request that the state deletes it for you. So that is the CTA and saving a copy of the CTA.